increase access to testing, screening, and care, which is essential to reducing HIV-related health disparities. You know, I was really pleased last year with our HIV summit at Lincoln that we actually ran out of, Boone County did the HIV testing, and they actually ran out of testing kits. So it was encouraging, but next year, definitely more, when the HIV summit comes, more kits will be provided or be available. Prevention, once again. So I think we've seen some amazing strides in our behavioral and biomedical research. And it continues to expand to the available prevention and treatment options. And I'm going to talk a little bit about that. And prevention is our charge as public health practitioners, as citizens in this country, to educate others, provide outreach, education in this area of HIV and AIDS. Some of these things, these biomedical advances that are very important, are programs such as the PrEP program or the pre-exposure prophylaxis program, where recent HIV/AIDS clinical studies have shown the effectiveness of AIDS treatment as a preventative for HIV-negative individuals who are at high risk of contracting HIV or who live in high-risk communities. Recent studies found that antiretroviral drugs can protect HIV-negative men who have sex with men and transgender women who have sex with men also. Microbicides, the study was found that HIV-negative women who use antiretroviral vaginal gel reduced their risk by 39%. So we at the department are very happy, NIH, CDC, to see some of these advancements in the area of biomedicine. I mentioned to you that the department is focused, and predominantly CDC, they have stated that approximately 44% of the nation's total number of AIDS cases are in 12 cities throughout the United States. I'll identify those cities in a minute. But the federal role in the they have identified a 12-city demonstration project is anchored by the CDC's Enhanced Comprehensive HIV Prevention Planning Program. It's a funded, a comprehensive assessment and planning process so that these 12 jurisdictions could identify what combination of prevention strategies would have the biggest impact to reduce new infections. These are the 12 cities that have been identified around the country. Our region does not have one of the 12 cities, but we're still aware of some of the health disparities as it relates to HIV in some of our cities, St. Louis, Kansas City, and other cities around our region. This right here, once again, President Obama and his administration wanted to develop a presidential advisory council on HIV and AIDS. The members and the chair of the Presidential Advisory Committee on HIV and AIDS were selected by the Secretary of Health and Human Services, Kathleen Sebelius, from among authorities with particular expertise and knowledge on matters concerning HIV and AIDS. The people who are on this council include researchers, physicians, educators, persons living with HIV and AIDS, and other advocates active in their communities through nonprofit groups and faith-based organizations.
Reconciliation between youth and adults. And so I'll say this, adults, remember that you yourselves were young at one point, and you did not listen to everything everyone told you, nor did you respond with loving kindness to every piece of advice that you received. But many of us were fortunate enough to still have adults in our lives that stuck it out. Keep sticking it out. Your young people, whether they're your biological or young people that you just care about deeply, they still want you there. And when the time comes, they will be asking you the questions that they need to know so that we can really be working towards this getting to zero. That also does mean mentioning that HIV and their sex lives is something that you're open to talking about.
I will say that the biggest action, besides the whole list that's in the packet, that I can suggest is educating yourself. Make yourself a center of knowledge around HIV/AIDS so that your family, your friends, people in your faith community, people in your neighborhood, people in your building, people who you interact with at work, all know that if they have a question, if they have a concern, if they have a family member who tells them that they're HIV positive or that has a question about HIV, that you're the one they can come to. There's a great program that's done in a lot of universities for LGBT youth, LGBT liberation called Safe Zone, where you say, you put up a sticker and you say, this is a safe zone if you want to talk about LGBT issues, you can come to me. We need HIV safe zone training. We need people to be safe zones for the people around them, the people in their communities, to talk about HIV. Be that person. Be that safe zone in your life, in your community, as you walk through the world. That would be my suggestion.
In a way, I want to build on you too, because this connects to my broader work that I've been doing in St. Louis, and it's about creating safe zones for access to care. So the work of the Spot is a huge example. It's an amazing place where it is safe for young people to come in. And when I think of all the people who are disconnected from basic healthcare services and how unsafe and unfriendly the system can be, it's creating that safe zone around health and wellness, period.
And every single community health provider, hospital should be a safe zone. Bottom line. We're talking about basic rights to health care here. Every single place should be a safe zone. But I do have to talk about aging and HIV. How many of you have relatives in their 60s, 70s, and 80s? Raise your hand. Guess what? They didn't hear about safer sex in high school. Have the conversation with your mothers, your fathers, your aunts, your uncles, your grandmas, and your grandfathers. Have the conversation. By 2015, older adults will make up 50% of all people living with HIV/AIDS. If we want to get to zero, we have to talk about every single person in the United States, including our elders. When you get your AARP card, that doesn't mean that your sex life stops.
Was the AARP card in the mail the other day. I turned 50 in August. Anyway, I know I don't look it. So anyway, plan of action that I think about is to educate women, not just about HIV, but about STDs. And I also have found that working with women, a lot of women don't even know about their bodies. And they even need to be educated about men's bodies. Teach them skills, how to dialogue with their partners about safer sex. Teach gender pride. Guide women to programs to help them develop self-esteem. And if they don't go to a program or willing to go to a program, because sometimes men, don't want their woman to get out there in a group, and learn anything about being a woman or being a strong woman, I should say. Those of us who are individuals, talk to our people one-on-one. So that's
very good.
I would like to thank this panel. I think it was you to help us seize the moment and move us closer to getting to zero. Thank you so much.